Posted February 27, 2019, 18 hours 2 minutes and 44 seconds. The AFL has confirmed to the ABC it will review of loophole which allows players with mental health issues to avoid suspension for illicit drug use. Under its current policy, a player who has tested positive more than once can receive treatment, rather than serve a suspension, if they have been diagnosed with a medical condition such as a mental health disorder by an outside doctor. The controversy that surrounds the AFL's illicit drugs policy, IDP, which has included former St Kilda captain Nick Riewoldt saying the use of illicit drugs in the game was out of control, has put the spotlight on how different sports deal with the issue. Much like Australia's leading football formats, the guidelines that surround each code's drugs policy are as unique as the sports themselves. From mandatory rehabilitation to no policy at all, the Big Four play by their own rules when dealing with players who test positive. Australian rules, rugby league, rugby union and a football all have their own regulations when it comes to players who have fallen foul of their IDP, unlike any other code. AFL players can avoid sanctions on the grounds of mental illness, although an AFL spokesperson said, strict conditions apply, you need to comply to the medical group conditions. If you don't, you become in breach of the policy and sanctions are enforced, they said. These are the current rules. Australian Football League Strike 1, $5,000 financial sanction, suspended, and compulsory counselling and education programs. Strike 2, 4-match suspension and $5,000 sanction imposed. Asterisk, the players' club is notified and the suspension is confirmed publicly. Strike 3, 12-match suspension and $10,000 sanction. Asterisk, if the club refers the player to an outside doctor who diagnoses the player with a specific medical condition, such as a mental health disorder, they can avoid suspension. That decision must be signed off by the AFL and include an ongoing treatment plan. Football Federation Australia, the game's governing body in Australia, does not have an IDP. Unlike other codes, the FFA does not pay for the independent testing of players for illicit substances. Instead, the sport is subject to the National Anti-Doping Policy and the World Anti-Doping Agency prohibited list. This means only illicit drugs that are deemed performance-enhancing are tested for. The FFA can apply sanctions under its Code of Conduct, and/or the player's contract, if a player is associated with illicit drugs. National Rugby League. The National Rugby League (NRL) has mandatory minimum sanctions for players who test positive to illicit drugs. There are no exemptions. The listed minimum sanctions apply, regardless of the medical or mental health of the player involved. Strike 1. The player receives a suspended fine and must undertake a mandatory treatment program. The player is also placed on a monitoring program which involves targeted testing. Strike 2. A 12-match ban, prospective termination, further monitoring, treatment and a fine. Strike 3. Offenders face more severe disciplinary action. Rugby Australia. Rugby Australia's policy has mandatory minimum sanctions in place for players who test positive to illicit drugs. And, like Rugby League, minimum sanctions apply. Strike 1. Treated as confidential as a health and welfare issue which includes targeted testing. Strike 2. A mandatory minimum 2-month suspension and a fine. No exemptions. Topics: sport, rugby union, mental health, drugs and substance abuse, doping in sports, Australian Football League, NRL, Soccer, Australia.